Nope, OCD isn't just about cleaning. Although some people do experience cleaning symptoms, OCD can manifest in almost infinite ways. Compulsions, the repetitious, purposeful physical or mental actions that the individual feels compelled to engage in, often fit into certain themes. These are checking. The need to check is the compulsion, but the obsessive fear might be to prevent damage, fire, leaks, or harm. Contamination. Often fear is that contamination might cause harm to oneself or a loved one. Mental contamination. Feelings of mental contamination can be evoked by times when a person perhaps felt badly treated, physically or mentally, through critical or verbally abusive remarks. It is almost as if they are made to feel like dirt, which creates a feeling of internal uncleanliness, even in the absence of any physical contact with a dangerous, dirty object. Symmetry and ordering. The need to have everything lined up symmetrically, just right, is the compulsion. The obsessive fear might be to ensure everything feels just right to prevent discomfort or sometimes to prevent harm occurring. Ruminations. A train of prolonged thinking about a question or theme that is undirected and unproductive. Unlike obsessional thoughts, ruminations are not objectionable and are indulged rather than resisted. Intrusive thoughts. Where a person generally suffers with obsessional thoughts that are repetitive, disturbing, and often horrific and repugnant in nature. Hoarding. Long considered to be a form of obsessive-compulsive disorder, hoarding disorder was probably correctly reclassified in the 2013 publication of the DSM-5 as a condition in its own right. However, it does become somewhat complicated because some people with obsessive-compulsive disorder will hoard for very specific obsessive worries and fears, and should still be diagnosed as having OCD rather than hoarding disorder. Each of these subtypes consist of an endless list of ways OCD takes control. Contamination can lead to washing hands, washing clothes, or anxiety about going outside or touching people. Symmetry and ordering could mean organising absolutely anything the brain feels needs to be organised. Shoes, books, anything. Checking could be checking locks and doors, windows, checking ourselves for disease, checking our bank balance. Understanding OCD subtypes helps us to understand that our thoughts are normal and we aren't alone. OCD needs to be treated, and knowing what subtype our compulsions fit into helps us to know it is OCD, if it is, and results in faster treatment, improving our quality of life.